honor to introduce Chiara Sabina. Dr. Chiara Sabina is an associate professor at the School of Social Work at Rutgers University and associate director of the Center for Research on Ending Violence. Her research centers on interpersonal victimization, especially intimate partner violence, sexual violence, and dating violence among Latinas. Dr. Sabina employs a contextual, strengths-based perspective with respect to interpersonal violence, focusing on understudied groups, the influence of cultural variables, help-seeking responses, and examination of the service delivery system. Dr. Sabina has received grants from the Fulbright Scholars Program, National Institutes of Justice, Pennsylvania Commission on Crime and Delinquency, Vision of Hope, and National Sexual Violence Resource Center to conduct her work on Latina victimization, victim needs, violence prevention, domestic violence services, and culturally informed services. Dr. Sabina is Senior Consulting Editor for Psychology of Violence, co-chair of the Research Advisory Group of Esperanza United, and an American Psychological Association Fellow. Welcome, Dr. Sabina. We're delighted to have you here today. Thank you so much for coming.
Thank you so much for the introduction. I'm happy to be here. And I believe you see my videos now. Are we all good on that?
Yes, we are.
All right, great. First, I want to thank you all for making time during this very busy time of the semester and the academic cycles. I know every year at this time, somehow I'm surprised by all of the things that need to happen before the semester finishes. So I really appreciate you taking time out to come and to hear about this research and to hopefully engage in some discussion. I am going to start my timer so I could try to be aware of not going on and on because there is a lot to share with you. So as was said, I'm at Rutgers University. I'm the Associate Director for the Center for Research on Ending Violence. And my work focusing on Latinx or Latina populations, I wanted to start with more of an overview of the population. As of the 2020 census, we are now 19.1% of the population. That's about 62 million people. And there's some trends where you can see where we're overrepresented and where we're underrepresented in different groups. So as you can see here, the population is young overall. So for Latinos, the average age is about 30. For whites in the US, it's 44. For Blacks and African Americans, it's 35. So you could see the overall youth of the population. Latinos represent a large percentage of the immigrant population in the United States. We also are overrepresented as far as being uninsured or incarcerated and living below the poverty line. So you could already see some very important demographic markers that would influence the experience of victimization among this population, both as far as risk factors and how to respond to it. A higher percentage also than our proportion in essential workers. But then when you get to positions of power, such as Congress or being highly educated, being represented in films, being in the medical profession, you see the underrepresentation of Latinos. So right away, we know that we're working with a population that has unequal access to power in the United States. And this is an important, and as you'll see, tied into how I look at the population overall. Interesting fact, so Connecticut is number 11 as far as the number of Latinos in the US. So you are on the higher end of representation in the country. As we know, The country as a whole is probably going to tip to the term majority minority by 2044. And for youth, that is tipping faster. So we see the fast growth of the population and of non-white populations. And my argument is that when violence research is only 3% of violence research is about this population, we need more research in order to understand what is happening and how we could respond to it. So that's where my work enters the field and hopefully sheds light on these issues. The first thing that we need to know when we're talking about this population is that it is a huge amount of diversity. So by definition, it's just a very diverse population. It's diverse with the country of origin. There's 33 countries in Latin America, 20 of which speak Spanish. This is also, obviously, there's a large population in the US. The country of origin of immigrants is also changing. Historically, Latinos have been mostly from Mexico. Those numbers are decreasing more currently, and there's more an increase in people coming from the Northern Triangle. So reasons for immigration also differ among people if they're labor immigrants or political refugees. And the generation. So I already said it's a largely that Latinos represent a large percentage of immigrants in the United States. But then there's also folks that have been part of the United States since before it was called the United States, right? So we have a large variation in generation and the history tied to the United States. So, you know, we have been part of the very foundation of this country, but there's these views that approach Latinos as the perpetual foreigner, even though they have been part and parcel of United States and American culture since the founding. Mestizaje is this idea of racial mixing, which has a long history in Latin America. And so you will see every sort of skin tone represented among Latinos. There's also Indian groups represented or indigenous groups represented, such as Taínos, Aztecs, Mayans, and they're also part of Latino identity or Latinidad. There's also been an Asian influence that people don't realize, dating back to 1565 in Latin America with trade and migration. So the result of these so-called racial mixing is a continuum of racial tones that don't necessarily fall within the US racial categorization system. So we have to recognize all of these different influences and heritages of Latinos in the United States. So this is part of what I think that we need to have an open and inclusive definition and to think about all of these forms of diversity among the population. So I mentioned language with indigenous language, Spanish, obviously also languages of other colonizers, such as the French, Portuguese, and documentation status. We have what appears to be about 23% of immigrants being undocumented. So bringing this to interpersonal violence research, intimate partner violence research, interpersonal violence research overall includes different forms of person-to-person violence or group-to-person violence that could span intimate partner violence, sexual assault, child abuse, and these are generally studied as separate silos. And that has been the history of them. But what we really need to start looking at, and newer research has done, is to look at the relationships between these forms of violence. And that's what I hope to highlight today. So some, like CDC has Connecting the Dots. There's a book about the web of violence. The term polyvictimization, all of those speak to the interplay between different forms of violence. We know that violence takes a steep toll psychologically, physically, and economically. And research has listed out different risk factors at different levels of the social ecology, including individual, demographic, historical, relationship factors, and social and community factors such as unemployment, which I pointed out already previously, chronic community disorder, lack of social integration. So taking this, my work has really focused on first understanding the victimization rate of Latinos and then seeing how it's related to other forms of violence. And I've looked at this in two different ways, re-victimization and poly-victimization. So re-victimization being experiencing violence at an earlier time and then at a later time in life, and poly-victimization being exposed to various forms of violence at the same time period, let's say in adulthood or within a year, however you're defining that time period. Also looking at how victims respond to violence and looking at them as active agents in that process. And then looking at how those sociocultural factors, which I kind of started with, influence the levels and responses to violence. So that's what I'm hoping to share with you today. And so the grounding of my work, I'm taking these as the assumptions to launch my research, and that is that the social positioning of Latinos in the United States influence their experiences. And so that history, the discrimination, laws that might, unduly burden Latinos, all of those play into the atmosphere in which victimization is experienced. And also looking at strengths within the population, so moving beyond this kind of deficiency lens and looking at what is positive and what works for the population. So, recognizing that this is a minoritized and racialized population, minority stress is going to play in. Immigration-related stressors are going to play into the victimization of folks. And so, looking at this with throughout my research. So I'm adapting the social determinants of health model. And this is a kind of simplified version that has broader level influences such as governance, macroeconomic factors, social and public policies, and values all influence the social hierarchy that's present in society. And this is related to one's socioeconomic position, including their education and income, and these get reinforced by power, prestige, and discrimination. The intermediary determinants are then exposure and vulnerability to health compromising conditions, and that's based on the material conditions of individuals, behavioral factors, psychosocial factors. And this is where I would place acculturation, which we're going to talk about, or the process of acquiring the dominant culture. And then the health and well-being here that we're looking at is the victimization experiences and exposure. So the takeaway from this kind of model is that to affect the health and well-being of Latinos in the US and their victimization experiences, we also need to attend to the power structures that are relevant. So the main constructs that I've looked at in my research have been acculturation, So this is a process about adapting to the receiving culture's practices, values, and identifications. And there's also the part of maintaining one's heritage culture. And so we're going to look at both of those, and those are both very important. And, original thinking on this was that as you become more Americanized, you give your culture of origin. So I'm looking at this in a different way, that you can be a bicultural person where you can have both your cultural heritage and that identity, and also the identity of being American, right? So I'm also looking at immigrant status. Here I'm really conceptualizing this as a yes or no variable about where you're born. There are more complicated ways to look at this. Sometimes I look at how long they've been in the US. So that's another way, another variable. And then this polyvictimization that I mentioned, or the exposure to multiple forms of multiple forms of violence at the same time. So I am going to talk to you today about the sexual assault among Latinas study, or my acronym for it is SALAS. And this was conducted, I am going to be very clear, this was conducted in 2008, which is now very old data. I'm going to give you some highlights from that. And then we're going to talk about what I'm doing now, because I am building on this study to give us more and updated information. I was actually hoping to have that all for you today, but I don't. But I want to leave you with this. These are the next steps that are taking place in this body of research, so that we can hopefully maintain conversation, and you'll be on the lookout for the results of that study, as will I. So, so the aim of the SALA study was to obtain victimization rates. This was the first national study on Latinas in the US. And we had a wide definition of violence, and didn't only look at sexual violence. We looked at other forms of violence. We looked at help seeking, and then these culturally relevant factors as well, kind of the topics that I've been talking about thus far. Here are all of the papers that have come out of the study. And so if you want follow-up information on the study, these are the ones that are available and published. The data is also publicly available, since it was a National Institute of Justice data, so funded study. So you could actually download the data and play yourself if something is really of interest to you. So this was a sample of 2,000 women. This was at the tail end of what was possible to do random digit dialing to landlines. And so this was random digit dialing to landlines. And we had, what we did is we did that random digit dialing in high density Latino areas in order to have an acceptable and feasible hit rate for screening. And so you'll see that the sample mostly came from these areas that were 80% or more Latino, which I think does influence the results, right? Because that ecological context might be very different when somebody is in a rural or a non-Latino area. And so you could also see this in most of the people taking the survey in Spanish. And this is also reflected in the mean age, right? So we have the mean age was 47. We had a 61% of the sample with high school education or more, and 61% being citizens, and over 50% being married. So in comparison to the US Census, our sample tended to be older, and we have a higher rate of high school graduates. We have a similar portion of being married and a smaller proportion of being US citizens. So we do have, for the rates data that I will show you, they are corrected and weighted for these demographic differences. So I'm going to go through this a little bit quickly, this part, but here is how we measured victimization. We used the lifetime trauma victimization history, and we had this these different types: assault, threat, sexual, witness, and stalking. So the victimization rates. I am going, if we were interactive, I would be taking guesses right now, but we're just going to do the da-da-dum, and here it is. So these were the levels of victimization. When you put these all together, these are lifetime in the blue. The orange colored is in childhood, and in the gray is adulthood. So you could see when different forms of victimization are more prevalent, what developmental period. And so when you look across these different types of violence, you see that more than half of the women in the study, 54% actually, reported at least one victimization in their lifetime. And of these, going to the polyvictimization point, 2/3 experience more than one form of violence. So we know that having one form of violence puts you at higher risk for having additional forms of violence. We do have a high stalking rate compared to what other studies have found, and this is something that I'm trying to investigate now in the follow-up study to this. Another comparison is this is going to be lower. Our estimates are a bit lower than obviously if it was a help-seeking sample. This is a nationally representative sample, so it is on par with the NSVIS, and you can look at different forms of violence, and in some cases we have higher levels for like sexual, and some about the same or lower levels depending on the type of violence, but it's comparable to national data across racial ethnic group. And it also shows that we need to move beyond physical and sexual violence, where there's a lot of research already on those areas. And when we look at things like being threatened or stalking, we also see high levels of victimization. So it calls us to look at more than physical and sexual. This is IPV. And when we looked at this, so it turned out that when we looked at any of those victimization types being perpetrated by an intimate partner, this was about 16%. This is lower than other national studies, and that's probably because we didn't use an instrument that just asked about violence in relationships. We used an instrument that asked about any form of violence and then who did that. And we know that a lot of the national numbers come from the CTS or adapted CTSs, so a conflict tactic scale. So we are showing here a little bit lower levels. The caveat to this, though, is that this could be an influence of having a large percentage of the sample being immigrants, which we're going to talk about as well. So who were the perpetrators? The perpetrators here varied between childhood and adulthood. I think this is important for us to recognize that, childhood victimization is mostly being perpetrated by relatives that aren't the parent or the siblings. That's 43% indicated those. And then other known folks, we already know that you're more likely to be victimized by somebody that you know, but we see this especially prevalent for children. In adulthood, we see partner victimization being very common, as well as, again, this other known category. So This could be friends, this could be colleagues, it could be other students if the person is a student, but in that category. And this is an important area to highlight. And I could show this to you in a series of a lot of slides, but I rather show one slide and walk you through it. So this is taking the whole lifetime picture and trying to give the profile of what their experiences were. Okay, so we have, when it says child single, that means the child experienced one type of victimization in their childhood, and that was it. Okay, so that's 15%. Adult, only in adulthood, one type of violence, 21%. Everything after that, right? So 36, not the 36%, everything after that is some form of complex victimization, either re-victimization later or multiple forms of victimization at the same time. So the multiple forms at the same time is for child poly-victimization, adult poly-victimization, single re-victimization, which is the same form of violence, physical in childhood and physical in adulthood. And then the main category is some of this, the more complex trajectories, where you have either re-victimization across types, and I have all those data numbers to show you the risk ratios by within the time period of childhood or within the time period of adulthood, or having multiple forms of violence at the same time. So I think this is really an important finding for us to talk about, because it shows that when we're talking to someone who came to us for a certain type of victimization, it is very likely that they have had multiple forms of violent exposure in their lifetime. And remember, we're just looking at interpersonal. I'm still not talking about community level violence or political violence or other forms of violence, right? I'm talking about interpersonal alone. So these victimization experiences are often more complex than we realize. And this is, shown by the data. And then what I think this begs us to do is to have some increased integration or collaboration, at least awareness of other forms of violence and how that might influence victims' experiences. What's unique about these findings is that re-victimization risk. This is traditionally looked at like sexual violence, and the odds of being sexually re-victimized in adulthood. That re-victimization risk goes beyond the same types of violence. It goes to different forms of violence. And we also need to expand beyond the traditional emphasis on partner violence and only physical or sexual violence. So we need to think broader. I think that's what this research is showing us. And so thinking comprehensively about prevention. If these forms of violence are linked, then how can prevention efforts go across the different forms of violence? And I think that's some of what the CDC is working with connecting the dots, right? Is how can how can prevention programs work across multiple forms of violence? Prevention starts early. We saw the rate of sexual abuse actually being higher in youth and adulthood. I think in one of these, we have the onset of violence being around 12 or 13 years of age. So it does very much start early. And then, looking at, for sexual abuse education, how can we leverage these findings around relatives and other known individuals? I'm not sure if people are typing in the chat. It's hard for me to look at that, but I will I appreciate it, and I will look at it as when I'm done presenting. So turning now to the cultural factors, I talked a lot about how these influence violence, at least theoretically, at the beginning of the presentation, and now let's look at some of the data. So first is immigrant status, right? This is that yes, no kind of comparison. And we do find significant differences. And I know for your health folks, this is probably going to be not a surprise, but for a lot of people, it is a surprise that the immigrants are actually reporting lower levels of violence than US-born Latinos, because people want to believe that if you're born in the United States, you have these positive experiences. And we're not seeing that in the data. What we're seeing is that immigrants actually have the, the Latino paradox, or the health paradox. So, and this is shown also in the victimization work. You could see this across every form of violence that we measured. Sure, reporting could have to do with this. We tried to do behaviorally worded. We did do behaviorally worded anchors here. And we have found this across various studies. So I do think that there is credence to this. And also, when you do look at it by years in the United States, there is that upward trend. So there's stuff going on here about exposure to US culture, potentially explaining this. It could be the healthy migrant idea, which is that those who are healthier are the ones that come to the United States, and therefore they're the ones, they're showing lower levels here. But we see by generation that levels of violence increase. So these are all some of the ideas that explain this. The other explanation that I offer is minority stress, right? So again, growing up in the US is growing up as a minoritized identity, which has a different experience than growing up when you're not in a minoritized situation, where you're in the majority in your culture of origin or your country of origin, right? So this speaks to some of those difficulties with integration. And interesting other research that I've also done on bias victimization is also showing bias crimes, not only against immigrants, but US-born Latinos as well, and even at higher rates sometimes than immigrants. So some of the work there. Now, going to the acculturation part of this. So this is how your language has adapted. This is how your friendship circle has adapted. That's the measure. Definitely limitations on measurement of acculturation. I don't think you could say otherwise. But so using one of the main measures that has the two subscales are Anglo orientation and Latino orientation, we put them both because those can both happen simultaneously. And interestingly, I mean, we have very clear results here for all of these. Being more Anglo-oriented, having more white friends, speaking English more, those sorts of things are associated with higher levels of victimization for Latinos. Latinas in particular here, because this is all women here. And then for Latino orientation, it has a protective factor associated with it, as does immigrant status, okay? So, what is going on here, right? What explains this? So I put forward the minority stress idea, right? Also acculturative stress could be playing in. We think that maybe Anglo orientation might be associated with going against the grain of your family, right? Maybe if the older generation wants a more traditional lifestyle or ideas or values, right? And you're expressing more US dominant ideas that could also lead to tension in relationships, perhaps. It could lead to breaks in social support. And so these are some of the ideas that would explain these trends. The protective qualities for Latino orientation could be the retention of values such as familialism and family strengths that can protect against various forms of victimization. They could be closely enmeshed with their family systems, rely on religion, for example. And when we look at this with the IPV as the variable here, we're getting similar trends. So this is found for both. And then I did look at interactions with this. They're not shown here, but Latino orientation is protective for both immigrants and US-born Latinas, but it's most protective for immigrants when it comes to sexual victimization. So sexual victimization is the one that I think generally has more complex findings because I think it really goes in line, or it's very much tied to sexual scripts of what is being a Latina woman, what is their role, what's acceptable and not acceptable. There's the idea of a male dominant culture and what it means to protect family and having sexual victimization in the family. So I think it gets very complex, cultural relationships with sexual violence. And so we're seeing some of that with the interactions come out. So the takeaways from this part of the work is that Anglo orientation may actually be a risk factor. So this, to me, talks about what is healthy about Latino culture, what is protective, and how can we build on that when we work with Latinx communities, right? So can we take the positive and at the same time acknowledge there still is violence in Latino communities. We still have a lot of work to do. It's not like it hardens anything, but we can do it in a way that respects culture as well, right? Let's see. So the cultural implications for this, la cultura nos cura, right? That culture can actually have a healing effect. And we find this in research. There was a study that actually looked at trauma-informed approaches and then trauma-informed plus culturally specific. And the trauma-informed plus culturally specific actually has better outcomes than just trauma-informed services. So this is something that we can look at in the future. And some of my other work has also looked at this about, so what do we do with these findings, right? And so I've used, it's not in my presentation today, but I could talk about it. I've used photo voice with Latina survivors. I'm also doing some work in Ecuador, where I spent a year for my sabbatical, looking at community dialogue circles and how we could have services outside of the traditional victim services field that kind of bring community together, right? And having that as a basis for healing, as opposed to a very individualized service system, for example. So these are, some of the next steps with this. In order to, I did have the help seeking information. I'm just going to show it to you very briefly because I want to get to what I'm doing now and what's going to be coming up. from this. So briefly, what we have is formal help seeking for sexual violence being only around 21%, and for all types of victimization around 32%. When you look at this is the sexual victims only, in the second column, and the third is all victims, and looking at some of these specific agency level help seeking, not the police, not the hospitals, but these social service agencies, where you see kind of the victim services field, these four being highlighted, they're very low. This is the people that come to the services are the tip of the iceberg of sexual violence survivors, right? So we need to understand why people aren't coming to traditional victim services and how we could better meet them in their own communities. Okay, so I'm going to stop there on the help seeking part because I want to get to this study now, which is like literally about to collect national level data. I got the contract signed this morning to actually go and collect the data. So we have new NIJ funding. The title of the study is Understanding Latina Victimization, Latina Experiences with Victimization, Intersectionality, and Discrimination. And I openly critique my previous work and look to build on it. One of the things that I think we need to really reckon with in a better way, and I've looked at differences among Latinas. You could see how I was talking about immigrant status, for example, but there's a lot more to look at that hasn't been really taken seriously. So in the time since I collected the SALAS data, obviously intersectionality and the idea of triple oppression and all of that has been with us, but it has really taken the limelight much more recently. And we need to understand how these various systems of oppression, not only the racism and the sexism, but ableism, ageism, heterosexism, how they influence the experiences of folks, and look at their intersectional identities within being Latina, right? That Latinas aren't a monolith. And although I've looked at some of that diversity, I haven't looked at enough of that diversity. I also haven't I've focused a lot on acculturation and how people adjust to culture in the US. Well, how about how they're perceived and how they're treated by people in the US, with the idea of looking at discrimination and discriminatory experiences, and how does that fit into responses to violence, right? So these are some of the new questions that I seek to answer. So for example, I'm looking at previous research has shown that those with marginalized identities have higher levels of victimization, which we know, for example, people with disabilities, sexual and gender minorities, but research really hasn't looked at those identities along with Latina identity, right? So that's what we're really doing in this study. There's also been extremely limited research attention to Afro-Latinas or Indigenous Latinas, groups such as domestic workers, farm workers, elders. All of these areas really need to be examined. And what I've shown is some interesting graphics here that just, actually looking into this, I learned it myself that Hispanics are overrepresented in the LGBT population. So we have higher rates than other groups, right? And so, and the race, and we know that new racial categorizations are coming, and all of that it is entailed in that, then that's a whole other topic of discussion. Other things that need to be taken into account is that there's been big demographic differences since Salas, right? We see this is the U.S. in 2000. This is the U.S. in 2020 with density of Latinos. What we see the areas getting more densely Latino. We also see a dispersion in areas of the United States that weren't there, where Latinos weren't represented before, right? So Latinos in this period have grown 3 times higher than the general rate of population growth in the United States. And so we could see why it would be very important now to get new levels and rates of victimization. So other things like sexual harassment hasn't really been studied at the national level for Latinas. And so we're able to add these areas of research in. As I said, I've done some work on bias victimization and discrimination. And so we have from our other study that 53% of Latinos experience bias victimization. And this is what would be considered from bias attack to what's called microaggressions of being followed or things like that, being called names, and showing that those that actually experience the bias victimization are at increased risk of experiencing interpersonal victimization. And so I think this is an important area for us to look at. So this could be one possibility for why we see such low levels of help seeking, and why potentially it could lead to poorer outcomes if they experience discriminatory experience, if they experience discrimination in seeking help. So the goals of LatVida are to look at current levels of interpersonal victimization in a nationally representative sample. I'll explain how I will do that, and being able to compare it to the data that I just showed you. The second part is to look at these intersectional social identities and related discrimination experiences, and then to look at how these identities are influencing the levels of victimization and the diversity among Latinas. So I'll be looking at both everyday and major discrimination experiences. So major being like discrimination in housing, discrimination in education, those sorts of things. And everyday being the more difficult interactions with people, or just being called names, those sorts of things, being followed in stores. And so we'll be looking at that. Also be looking at help seeking and the mental health functioning of victimized Latinas. And of course, to focus on what we can do. I keep on using both my mouse and okay, there we go. So we'll also be looking at what is protective, right? Is ethnic identity protective? So I've insinuated that earlier, but now we'll be able to quantitatively look at that. Also looking at social support and hope as a construct that could help people deal with violence. So how is a very good question, and I'm going to explain this in 3 minutes. So for the nationally representative part, we will use the Knowledge Panel Latino, which is from Ipsos. They have an address-based sample that is now in a panel survey online. And so they did the address-based sampling, and actually if a person didn't have access to internet, or they provided access to internet. So it is a representative national sample garnered online. They oversampled Latinos to make sure they have representation. And this is often used by like the Pew National Research Center, which produces a lot of work on Latinos in the United States. So we'll be using that to get a nationally representative sample, and that's the part that is about to launch hopefully this month. And then we have, in addition to that, to get at the intersectionality part, we're going to do face-to-face recruitment with help of promotoras that are part of the Robert Wood Johnson University Hospital, connected to Rutgers. And they will be doing community outreach for underrepresented groups. I talked to you about the importance of getting these intersectional identities. And so we are going, after the 2000 national sample, we're going to recruit another 1,000 that really just gets at the diversity within the community, the umbrella term of Latina. And in order to do that, I am seeking representation across these, I think it comes out to 36 or 32, I can't remember the number right now, intersectional identities, even when you crudely mark race and gender just as cis or trans, and sexual identity as hetero or non-hetero. I mean, those are very crude categories, but even when you have those crude categories, when you make the intersectional identities, you have very many of them. And so what we will be doing is trying to get as much representation within each of these categories as possible in order to look at how these different forms of social markers influence the victimization experiences. Our partners for this are at Indiana University, Esperanza United, which is the National Technical Assistance Organization that works with Latino communities. And then, as I mentioned, the hospital, and then we have a community advisory board to really help us ground our research in what's going on in the community. And so I'm hoping that this really gives us a new perspective and increases our understanding in ways that expand, for example, on sexual harassment. We're also measuring trafficking, which hasn't been measured previously at a national level for Latinas. So we're hoping that this really helps expand our understanding. So these are the points that I really hoped to drive home with you throughout this presentation. I hope that this has given you some food for thought and hopefully can lead to some conversation. I'm happy to stay in touch with folks as these new research studies and results come out. So that is my presentation. Thank you very much.
Thank you, Chiara, for that fantastic talk. I think what we'll do now is we can go ahead and open it up to questions. We have a few minutes left, so feel free to just unmute yourself and ask the question or type in the chat.
Hi, Chiara.
Hi, Maite, how are you?
Good, thanks. Nice to see you.
Good to stock the audience with your friends.
Good. Great presentation. Thank you so much. And very, very interesting, all the data. One thing that I was wondering is about economic violence, particularly in terms of IPV. And that's something that is being measured and addressed a lot in Latin America, where many researchers and women's groups show the impact of economic violence that women experience, but I don't see much about that here in the United States. So
Yes, and that did come up in our community advisory board. It is going to be part of Latvita. And it's a few questions, but it's things that would be studied pretty, when we think about economic abuse, things like taking the paycheck or not allowing access to bank accounts. We're including those questions. We're also including denying them the ability to work, right? Making someone stay at home and not work outside in the uh, outside of the home. So we're including those things. We do think it's an important aspect to focus on, and it's within the coercive control questions. The other type of control type questions that we want to get at is reproductive coercion as well. So, so those will be new additions to the field and rounding out our understanding of IPV among Latinas. Yeah.
Great. I have more questions, but I can wait.
Mhm.
Hi, my name is Evelyn. I have a question.
Hi, Evelyn.
Hi. If somebody was interested in applying for the or being part of the research, how can they reach out to you? If it is an option.
Of course. My email is in the chat.
Okay.
Feel
Perfect.
free to email me. We have a group, and with the community advisory board, well, there's the research group that's doing, we're meeting bi-weekly. We're moving things, going to be, making sure that all of the data collections happen properly and all of that. Then there's also the community advisory board that is guiding the process.
Okay.
They're not as involved regularly because I realize that folks are really stressed and low on time. And so we're trying to make it, when we do meet, have the maximum influence when we meet. So we've met 3 times so far. And we'll be meeting as we move into the kind of community recruitment.
Cool. Sounds good. Thank you.
Thank you.
I have a question, Chiara. So, I'm very mindful, of course, of the current, political climate and the many hate crimes that are being committed based on religion, race, ethnicity, and the uptick of those crimes over the past several years. And so I'm curious, thinking about the SALIS data and thinking about the political climate right now, focus on immigration, all of the issues that are going on in our country. Is in is it Lavitas in Lavita study? In that study, will you be able to capture kind of that level of political change, or even just the current political, climate as it relates to that, aside from discrimination, but more kind of like on an even higher level in terms of what's happening in the U.S.
Yeah, like fear or uneasiness. No, honestly, no. We will have the everyday discrimination and the major discrimination. We won't have other forms of violence. And we've kind of played around with this a bit because we're keeping it on interpersonal violence and not going into the political forms of violence, which is a whole other area. And I do think it's important, but it is more than we could chew right now for this study. What I'm hoping to do is to contact some of the folks and interview them. And now that's not funded, so I'm looking for ways of possibly funding that because the NIJ grant is just for the parts that I've mentioned to you. But if I'm able to do that, we can then ask some of those more situational and context type questions. Another interesting thing to do would be to do secondary level kind of analyses where we look at differences between states and what has been, more immigrant friendly versus non-immigrant friendly, and see if there's differences that way. And we tried to fund a project that way, and it turned out to be so expensive to try to conduct a study. But I'm hoping that some of this data will allow us to speak to that, some of those geographic differences as well. So there's ways around it, but we don't have it directly.
That's great. Thank you. I think we're at the end of our time together. However, I don't know if anybody, Chiara, first of all, if you're able to stay on. I see we have another hand up. You're welcome to if you're able to.
Yes, yeah, sure. Azucena?
Hello. Hi, good afternoon. I was talking. I didn't unmute
Sorry,
myself.
now we hear you.
I do have a question in regards to, you mentioned that you were going to obtain qualitative work in terms of interviewing them. Would you also be documenting colonial violence and its relationship to interpersonal violence, specifically for Indigenous and Afro-Latinas, if that were, be representative of your sample?
That is a great question. I think what we need to do is really think through that. What we have right now, as far as for everyone, are things like being critiqued for the way you look and, the way you speak and, racialized features. We have those types of things that, speak to norming whiteness. And so there's just a hint of it, but we do not have a very, I would say, critical questions on, colonial violence or the effects of colonialism and the manifestations of it now. I'm definitely open to it. So if you want to have further conversations, I'm happy to do that, to bring that in.
That would be wonderful. Thank you. And my second question would be, are you looking at first and second generations versus like the immigration paradox and with resources and social capita?
Yes, that we are able to do. Luckily, we'll be able to know where parents and grandparents were born. We're not going beyond that. So we'll have those 3 generations to look at as far as differences.
Thank you very much.
Yeah. Bye. Thank you.
Thank you. Have a great day.
All right. Take care.
Thank you, Chiara. Thank you for your time. That was fantastic.
Thank you very much. I really enjoyed it. And thank you for staying this whole time.
Oh, our pleasure. Good luck finishing up the semester.